Government shutdown live updates as Trump is set to meet with congressional leaders 25 minutes ago. Soldiers likely won't get paid during shutdown, despite big beautiful bill funds. Active duty service members are considered essential personnel and will continue to report for duty during a shutdown, but likely won't get paid until Congress authorizes new funding for the armed services, despite tens of billions of dollars allocated to the Pentagon in Republicans' One Big, Beautiful Bill Act. Chris Towner, policy director at the Committee for a Responsible Federal Budget, a Washington think tank, told CBS News that the $150 billion approved for the Pentagon over the summer was meant largely for other purposes. It depends a little bit, but for the most part, no, they can't pay soldiers with that. The way that we pay soldiers is through a military compensation for each of the armed services. And none of those accounts got plus-ups in the One Big Beautiful Bill, Towner said. Towner said there are a handful of fungible accounts that the Pentagon could use to pay some soldiers, but doing so would be really inequitable. He said the department could theoretically use about $1 billion under the OBBBA that was designated for the Pentagon to help with immigration enforcement. That would be the only money that I would think that maybe they'll spend, but I don't even think they'll spend that, because it's only $1 billion, Towner said. He noted that Congress could pass a separate bill ensuring soldiers get paid, which lawmakers did during a previous shutdown in 2013. In its guidance for a possible shutdown, the Pentagon said there are about 2 million active duty service members who would continue to work during a lapse in funding. 32 minutes ago, Kane, I want an assurance that if we make an agreement, it will be honored. Senator Tim Kaine, a Virginia Democrat who represents thousands of federal workers, outlined to reporters ahead of the White House meeting on Monday what he said is a very solid proposal from Democrats to ameliorate the effect of drastic cuts to our state and our country's healthcare network, while noting that we're willing to negotiate. Kaine said there has been GOP interest in Democrats' push to extend healthcare subsidies. But he added that I definitely want to believe and be firm that a deal's gotta be a deal. And I want to see a commitment, Kaine said. I don't think every I has to be dotted to satisfy me, but I want to see a commitment to doing what's right by the health of my constituents. Kaine said he would wait to see what came out of the White House meeting. The Virginia Democrat said, the main thing I'm worried about is a president who would agree to a deal and then immediately start firing people and tearing everything up, because that's what he's done. So I want an assurance that a deal is a deal. Kaine said, I want an assurance that if we make an agreement, it will be honored. When asked whether Democrats were risking a painful shutdown for their constituents by drawing a red line on health care, Kaine responded, is there a problem with asking? I mean, isn't this the way this is done? He said, 1:09 p.m., how would a government shutdown affect Social Security recipients? Even if a U.S. government shutdown begins on October 1st, the 74 million Americans who collect Social Security will continue receiving their monthly checks, although some services could be disrupted due to a potential halt in federal activities, according to experts. Social Security benefits are covered by mandatory spending, which means that the funding for the program has already been approved by Congress without an expiration date. As a result, Social Security recipients, including retirees, disabled Americans, and the dependents of deceased workers, wouldn't see an interruption in their monthly payments if the government shuts down. However, other Social Security services could be impacted by a shutdown, according to the National Committee to Preserve Social Security, Medicare. The Social Security Administration's working budget requires approval from Congress, with lawmakers currently at loggerheads over funding the federal government past September 30th. If an agreement isn't reached before then, some Social Security services could be temporarily halted until the issue is resolved, according to both the Social Security Administration and experts on the retirement program. The system hasn't missed a payment in its entire 90-year history, and won't start now. Max Richtman, CEO of the National Committee to Preserve Social Security Medicare, said in an email. But customer service at the Social Security Administration, SSA, may be disrupted, including benefit verifications, earnings record corrections and updates, overpayments processing, and replacing Medicare cards. Read more here. https://www.cbsnews.com/Social Security Government-2025 Impact Benefits Checks Services. In a shutdown, the federal government must stop all non-essential functions until funding is approved by Congress and signed into law, except for programs that are funded by other means, like fees or other legislation. Each agency determines what work is essential and what is not. Members of Congress make that determination for their own staff as well. The Constitution says the Treasury Department cannot spend money without a law authorizing it. Under a statute known as the Anti-Deficiency Act, agencies are required to cease operations, with certain exceptions, in the absence of funding authorized by Congress. No money can come out of Treasury whether you're essential or not essential. But who can keep working and incur obligations, even when there are no appropriations? There are 3 exceptions, said Matt Glassman, a senior fellow at the Government Affairs Institute at Georgetown University. The exceptions under the Anti-Deficiency Act allow the government to fund operations to protect life and property and keep officials involved in the constitutional process on the job, like the president, his staff, and members of Congress. Essential employees continue to work during the shutdown, but don't get paid until funding is restored to their agency. Employees in non-essential positions are typically furloughed until the government is funded again, although that could look different this time if there are widespread layoffs. Under a 2019 law, furloughed employees are guaranteed to receive back pay once the shutdown is over. Read more on what happens during a shutdown here. https://www.cbsnews.com/news Government Shutdown 2025. Lessons of March funding fight color Democrats' shutdown approach. The last funding fight has seemed to color the Democrats' approach this time around. In March, Democrats pledged to push back on a GOP funding plan, but Schumer changed course. https://www.cbsnews.com. www.cbsnews.com/Government Shutdown 2025 Senate Democrats vote at the 11th hour, delivering one of the Democratic votes necessary to propel the measure to passage and prevent a shutdown. At the time, Schumer argued that a shutdown risked doing more damage to the federal government, despite intense criticism from some within his own party. Since then, he's faced heated opposition from Democrats, including calls for new leadership and plummeting poll numbers. Now, faced with the latest funding fight, he's changed his tune. When asked whether the key difference between the last spending fight and this one is the pressure from the Democratic base to stand up to Mr. Trump, the minority leader told https://www.nbcnews/meetthepress video. Chuck Schumer says Trump meeting only a first step to avoiding shutdown. Full interview 247348572. UTM source, email, UTM content, Leader 20 Thune, says 20 government 20 shutdown, 20 E2, totally up to the Democrats E2 8N, full, interview. UTM campaign equals MTP percent E2, 20 Sen, ... 20 John Thune, 23A, on a government shutdown, /3A, totally up to 20 Democrats, what 20 Democrats have done here is take the federal government as a hostage to get back what's just happened. 20 extension 2C, the American people, E28N, NBC on Sunday, absolutely not. We're hearing from the American people that they need help on health care, he said. Since March, Republicans in Congress passed the signature legislation of Mr. Trump's second term, which included restrictions to Medicaid that Democrats disavowed. And the GOP also approved a rescissions package that clawed back congressionally approved funding for foreign aid and public broadcasting, which Democrats say has increased distrust that funding agreements will be honored. But in March, Schumer also argued that a shutdown would have given wide latitude to the executive branch and the Department of Government Efficiency to make deeper cuts to the federal workforce, and he noted that there wouldn't be an off-ramp to reopen the government. Schumer addressed the change of tune Sunday. As for these massive layoffs, Guess what? They're doing it anyway. The heat is on them when they do this, Schumer added, and the American people won't like it at all. 11:13 a.m. Leavitt says Trump is giving Democrats one last chance to be reasonable today. White House Press Secretary Caroline Leavitt told reporters ahead of the meeting on Monday that our message and what we want out of this is very simple. The president wants to keep the government open. He wants to keep the government funded. There is zero good reason for Democrats to vote against this clean, continuing resolution, she said, adding that the president is giving Democrats one last chance to be reasonable today. Asked whether the president is prepared to negotiate with Democrats in the meeting, Leavitt said, "There's nothing to negotiate when you have a clean CR." There are, of course, important policy discussions that can be had, but we are nearing a government shutdown, and we are nearing a funding deadline, Leavitt said. The president wants to make this deadline. He wants to keep the government open. 11:05 a.m. Jeffries says Dems are looking to have a good faith negotiation about averting shutdown at White House. Jeffries, speaking to reporters at the Capitol, reiterated Democrats' position ahead of the meeting at the White House on Monday, saying we've made clear that we are willing to find a bipartisan path forward on a spending bill negotiated by Democrats and Republicans, but it has to meet the needs of the American people. What we will not do is support a partisan Republican spending bill that continues to gut the health care of the American people, Jeffries said. The House Minority Leader said he and Schumer are in lockstep, adding that we're heading into the meeting to have a good faith negotiation about landing the plane in a way that avoids a government shutdown, but does not continue the Republican assault on the health care of the American people. Jeffries argued that over the last few months, Republicans have created a health care crisis in the United States of America, with their restrictions to Medicaid in the One Big Beautiful Bill Act. He said Republicans have refused to extend the Affordable Care Act tax credits, and as a result of that, millions of working-class Americans are going to experience skyrocketing premiums, co-pays, and deductibles at a time when America is already too expensive. This is a five-alarm fire in terms of the Republican-caused healthcare crisis, and that's why Democrats are determined to turn things around, he said. Asked whether Democrats would bat a clean continuing resolution if they get assurances that Republicans are willing to negotiate on extending the healthcare subsidies going forward, Jeffries said the Democrats' position is a permanent extension of the Affordable Care Act tax credits. No one can trust their word on health care. Are you kidding me? Jeffries said. These people have been trying to repeal and displace people off the Affordable Care Act since 2010. That's 15 years. And on behalf of the American people, we're supposed to simply take their word that they're willing to negotiate? 10:35 a.m. Pentagon shutdown plan calls for 334,904 civilian workers to be furloughed. The Defense Department, which the Trump administration has rebranded the Department of War, released its contingency plans for a shutdown over the weekend. The document says 334,904 of the department's 741,477 civilian workers would be furloughed in the event of a funding lapse. The department would retain 182,684 civilian workers whose pay comes from sources other than annual appropriations, as well as 223,889 who are necessary to protect life and property. The 16-page guidance document, https://media.defense.gov/2025, Sep. 27, 200893631/1/contingency, Plan Guidance for Continuation of Operations.pdf, notes that the roughly 2 million service members who are on active duty, including reserve component personnel on federal active duty, will continue to report for duty and carry out assigned duties. It lists activities that are accepted under the Anti-Deficiency Act, the law that bars agencies from spending without approval from Congress, and says employees whose work is not accepted will be furloughed. Employees who continue to work through a shutdown are not paid until Congress approves more funding. Civilian personnel, including military technicians, who are not necessary to carry out or support accepted activities, are to be furloughed using lapse in appropriations, often referred to as shutdown, procedures and guidance provided by the Office of Personnel Management. The document says, only the minimum number of civilian employees necessary to carry out accepted activities will be accepted from furlough. 10:15 a.m. A history of government shutdowns. The 14 times funding has lapsed since 1980. A government shutdown occurs when Congress fails to approve funding for federal agencies. Before 1980, agencies largely continued operating. https://history/shutdown, government shutdowns, during a lapse in funding with the assumption that Congress would act quickly. But in 1980 and 1981, then Attorney General Benjamin Civiletti authored a series of legal opinions that found government agencies didn't have the authority to continue running during a gap in funding. President Ronald Reagan oversaw 8 shutdowns during his time in office, the longest of which lasted 3 days. There were 3 funding gaps between 1990 and 1995, then none until 2013. The threat of a government shutdown has become more frequent over the past decade, as Congress has found itself engaged in funding fights that are ultimately resolved with massive, year-long spending packages. The most recent lapse in government funding, in late 2018, caused $3 billion in permanent losses, according to the Congressional Budget Office, https://www.cbo.gov/systemfiles. 54937, partial shutdown effects.pdf. Hundreds of thousands of federal workers are expected to feel the impacts of a shutdown. https://CBS News/government shutdown federal agencies. If a deal isn't reached this time around. Read about the 14 times the government has shut down since 1980 here. https://CBS News/government shutdown history. Updated 9:42 a.m., the state of play in the Senate ahead of the shutdown deadline. Earlier this month, the GOP-controlled House passed a bill, https://House vote government shutdown, known as a continuing resolution, that would extend current funding levels for 7 weeks and thus avoid a shutdown. But the bill fell short in the Senate, where 60 votes were needed. Republicans control 53 seats in the upper chamber, meaning they need Democratic votes to get the bill over the finish line. But Senate Democrats appear mostly united in opposing the bill, arguing Republicans should have negotiated with them to find an outcome they could support. Senators are returning to the Capitol on Monday afternoon, where they are set to convene at 3 p.m. to search for a path forward. Thune told https. UTM campaign MTP %20, 80%. 93 for Senate, 20 John %Thune, 20 on a government shutdown, 20, 80%, totally up to the Democrats. What the Democrats have done here is taking the federal government as a hostage, and for that matter, by the federal government, by that matter, by that matter, by that matter, by that matter. 20 extension %2, the American people, E2 89, NBC, that whether the government shuts down is totally up to the Democrats, outlining that there is a bill sitting at the desk in the Senate right now that the House passed that would keep the government open. He said the continuing resolution could get another vote this week. This decision, in my judgment at this point in time, is up to a handful of Democrats, Thune said. We need 8 Democrats to pass it through the Senate. Updated 9:42 a.m. Congressional leaders set to meet with Trump at White House at 3 p.m. The top 4 congressional leaders, Senate Majority Leader John Thune, Senate Minority Leader Chuck Schumer, House Speaker Mike Johnson, and House Minority Leader Hakeem Jeffries, are set to meet with the president at the White House around 3 p.m. The meeting comes as Democrats have for weeks sought to get Republicans to the negotiating table. Schumer told NBC.www.nbcnews.com/politics/Trump administration Comey, indictment, Trump, RCNA 234211, on Sunday that after Mr. Trump canceled a meeting with the leaders last week, he called Thune on Friday and urged him to get the leaders together for a meeting. The New York Democrat called the meeting a first step, saying, "We need a serious negotiation." Updated 9:42 a.m. Senator Amy Klobuchar says Republicans have created a healthcare crisis. Senator Amy Klobuchar, a Minnesota Democrat, told https://www.cbsnews.com/news/Amy Klobuchar, Minnesota Senator Face the Nation /28 2025, saying, Face the Nation with Margaret Brennan on Sunday that Democrats are united in pushing for an extension of expiring health insurance subsidies, accusing Republicans of creating a health care crisis. My constituents, Americans, are standing on a cliff right now, with these insurance premium increases that are upon them, Klobuchar said. So Democrats are united in pushing on this and saying, look, let us do something about this crisis before it's too late. Klobuchar, a member of Senate Democratic leadership, outlined that without the extension of the health insurance subsidies, premiums follow. www.kff.org/interactive/how much more would people pay in premiums if the ACA's enhanced subsidies expired, could increase by an estimated 75%. And she stressed that addressing the subsidies is a now thing. It's not a December thing. It's not a January thing. It's not an off-ramp, Klobuchar said. It is something we have to get done now. Updated 9:42 a.m. Trump. I just don't know how we are going to solve this issue. Mr. Trump told CBS News on Sunday that I just don't know how we are going to solve this issue. He indicated that a shutdown is likely unless Democrats back down from their negotiating position. The president cast the Democrats' current demands, which have centered on extending Affordable Care Act insurance subsidies, as ill-advised. He said if the Democrats want to discuss health care, they should work with him to prevent undocumented migrants from accessing public benefits. The Democrats, incredibly, want to keep their old policies of open borders, and we're not going to have it. We're not going to allow it, Mr. Trump said. He added that any possible health care negotiations must address immigration and border-related matters. Otherwise, it's just not acceptable for us. Read more here. https://www.cbsnews.com/Trump confident government shutdown meeting.